Hello everyone. In this video, we discuss about assessment of growth. How do we assess growth? That is by anthropometry using weight, height, head circumference, chest circumference, midarm circumference, skin fold thickness, and BMI. Now we go for weight. How do we measure weight? Using beam scale for infants, that is infant type beam scale, and for adults by digital weighing scale, or for older children by digital weighing scale. So beam scale looks like this. So we should place child either naked or with minimal clothing. How do we weigh? With minimal clothing or naked like this and using the beam scale. Then for bigger child we use digital weighing machine. Now we go for how does the rate of growth of weight occurs. Suppose if the birth weight is A kg, then it doubles by 5 to 6 months. The birth weight doubles, that is 2A. Then by 1 year it will triple, that is 3A. By 2 years it will quadruple, that is 4A. By 3 years it will become 5 times the birth weight. By 5 years it will become 6 times the birth weight. By 7 years 7 times the birth weight. By 10 years 10 times the birth weight. This is how rate of growth of birth weight occurs. Means rate of growth of weight occurs. If it is birth weight is A, then doubles by 5 to 6 months, triples by 1 year, 4 times by 2 years, 5 times by 3 years, 6 times by 5 years, 7 times by 7 years, and 10 times by 10 years. This is our rate of growth of weight occurs. Suppose if we don't know the birth weight, we can use the formula. That is, if the child is less than 1 year, we can use x plus 9 by 2, where x is age in months. From 2 to 6 years, we use the formula 2x plus 8. 2 plus 6 is 8, so 2x plus 8. Then from 7 to 12 years, so 7x, 7 minus 12 is minus 5. So 7x minus 5 by 2. This I am telling this to remember. There is no logic behind this. 7x minus 5 by 2 is the formula for expected weight if we don't know the birth weight, where x is age in years. Then we go for height or length measurement. So we measure length till 2 years of age. Then 2 and after 2 years we measure height. Why this is so? The child stands by 10 months and walks by 13 to 14 months. Still we are measuring length till 2 years of age. Why? Because of exaggerated physiological lumbar lordosis. Suppose if we measure height for less than 2-year-old child, so we measure because of lumbar lordosis, we measure the height which is smaller than the actual height. So if we measure the height, it shows the less the number the actual height. So we measure length. It shows the normal length. Getting it right? So till 2 years we measure length because of exaggerated physiological lumbar lordosis. How do we measure height? We measure height using stadiometer and length using infantometer. So what is the important things while measuring height? We should measure without footwear and in Frankfurt plane. Frankfurt plane is the one plane from the point above tragus and the point that is which is at the medial canthal of the eye. It should be in the same line and parallel to the ground. That plane is called as Frankfurt plane. And we should measure by removing footwear. We should remove the footwear and the points which would touch the back of the body is occiput, shoulders, buttocks, calves, and heels. So these are the points which should touch the back of the board. That is occipital protuberance, shoulder, buttocks, calf muscles, and heels. Then we measure length using infantometer. This is infantometer. It has fixed head end and mobile foot end. Fixed head end. So head end is fixed. We can't move that. And foot end is mobile. We can move according to the length of the child and fix the foot of the child on the mobile foot end. And we measure the length. See, this is the child who is short. That is less than 46 centimeter. So we measure the pink line. So that is 44.3 centimeter. Suppose if the child is more than 46 centimeter, like this child is more than 46 centimeters. So we had to move the foot end. So we place the foot of the child on the foot end and head end is fixed. So then how do we measure this child length? We measure using white line. That is 63.2 centimeter. We measure using white line. That is 63.2 centimeter is the length of this child. At birth, the length is 50 centimeter. So by 1 year, it grows up till 75 centimeters. The rate of growth is 50%. So length increases by 50% in first year of life. This is the maximum in a lifetime. The rate of growth of length occurs. That is 25 centimeter per year. So even in growth spurt, maximum growth spurt will have around 10 centimeter, 11 centimeter per year. Never in life a person will have growth rate of 25 centimeter per year except for first year of life. Maximum growth of height occurs at first year of life, that is 25 centimeter per year. By 2 years, the length will become 88 to 90 centimeter. After 2 years, we use the formula till puberty. After 2 years, usually the length grows by 5 to 6 centimeter per year. So till puberty, then the pubertal growth spurt occur where it will grow around 8, 9, 10 centimeter per year. Okay. So from 2 years till puberty, we use the formula 6x plus 77 centimeter. 6x because the length grows by 5 to 6 centimeter per year. Length or height grows by 5 to 6 centimeter per year. So we are using the number 6x plus 77, where x is age in years. So after this, should measure the upper segment. Upper segment is from vertex till pubic symphysis and lower segment. Lower segment is from pubic symphysis till the foot. So we can measure upper segment and we can minus with the height that will come up to the lower segment, or we can measure lower segment and minus with the height that will come up to the upper segment. No need to measure both separately. Either we measure upper segment and subtract with the height to get the lower segment. At birth, the ratio upper segment to lower segment ratio is 1.7 to 1.9 is to 1. At 1 year of life, it will become 1.5 is to 1. Then at 3 years, it will become 1.3 is to 1. At 3 years, 1.3 is to 1. Then at 7 to 9 years, it will become 1 is to 1. Then by 11 years, it will become 0.9 is to 1. At birth, 1.7 to 1.9 is to 1. 1 year, 1.5 is to 1. 3 years, 1.3 is to 1. 7 to 9 years, the ratio will be 1 is to 1. Then at 11 years, the ratio is 0.9 is to 1. Then we go for next anthropometry measurement, that is head circumference or occipitofrontal circumference. How do we measure? By cross-tape method. We measure by cross-tape method using non-stretchable tape, not table, tape, using non-stretchable tape by cross-tape method. And we measure 3 times and we consider the highest head circumference, not the mean head circumference. We consider the highest head circumference like this. We measure by cross-tape method, we measure where the intersection occurs 51 and we minus it by 4.5. So 51 minus 4.5 is 46.5 centimeter is the head circumference of this child. Cute little child having a circumference of 46.5 centimeters. We measured using cross-tape method. We did 3 times and took the highest value. Remember this, we should take the highest value, not the mean value. At birth, the head circumference is 33 to 35 centimeter for a term child. We are talking about the term child here. Then it should be at birth when we measure, no, it should be done after 24 hours of birth because of the physiological molding and caput succeedinum can hamper the measurement. So only we measure after 24 hours after birth. How does the rate of increase in head circumference occurs? See, for first 3 months, the rate of increase is 2 centimeter per month. Then from 3 months to 6 months, the rate of increase is 1 centimeter per month. From 6 months to 12 months, the rate of increase is zero point 0.5 centimeter per month. So total increase in 0 to 3 months is 2 centimeter in first month, 2 centimeter in second month, and 2 centimeter in third month. That is total of 6 centimeter. From 3 to 6 months, the total is 3 centimeter. Overall, in 6 months, the child will grow 6 centimeter in first 3 months, then 3 centimeter in next 3 months. That is 9 centimeter. Then from 6 months to 12 months, the child grows zero point 0.5 centimeter per month. That is total of 3 centimeter. But from overall in an year, the child grows 6 centimeter in first 3 months, 3 centimeter in next 3 months. That is 9 centimeter total. Then 3 centimeter in 6 months to 12 months. That is overall 12 centimeter in the first year. So in first year, the child's head circumference increases by 12 centimeter. This is one of the important MCQ questions to calculate the expected head circumference. They might ask for 3 months, so it will be more than 6 centimeter from the birth. At 6 months, it will be more than 9 centimeter from the birth. At 1 year, it will be more than 12 centimeter from the birth. From 1 to 3 years, the rate of growth will be zero point 0.2 centimeter per month. Then we go for chest circumference. Usually chest circumference doesn't have significance alone unless it is compared with head circumference. So how do we measure chest circumference? We measure posteriorly from T4 vertebra. How do we get to T4 vertebra? C7 is the palpable vertebra. Cervical, C7 cervical spine is the palpable vertebra. From there you go 4 vertebrae down, that is T1, T2, T3, T4. Posteriorly, we make that point, and anteriorly, at the level of nipple, we do cross tape method and measure. All circumference are measured using cross tape method. See, chest circumference, usually it should be compared with head circumference. So, chest circumference at birth is less than the head circumference, but the difference is not more than 3 centimeter. Suppose if it is more than 3 centimeter, either it should be increase in head circumference or decrease in chest circumference. So if the difference is more than 3 centimeter, we should consider there is head circumference increase, that is macrocephaly, or some condition which is causing decrease in chest circumference, something like as IUGR, usually asymmetrical IUGR, where head grows in the first trimester of gestation. After second trimester, some insult has happened to the fetus and the fetal growth restricts. That is called as intrauterine growth restriction, where chest circumference will be less. But because of first trimester growth, the head circumference will be normal. But the difference is more than 3 centimeter in this condition. Head circumference equals chest circumference by the age of 9 to 12 months. Suppose even after 12 months, if head circumference is more than chest circumference, we measure that as Jellyf ratio. So head circumference by chest circumference greater than 1 after 1 year. So again, two reasons. Either head circumference is high because of macrocephaly, or chest circumference is low because of EUGR. EUGR is nothing but malnutrition, extrauterine growth restriction. One of the common causes malnutrition. That's how we measure Jellyf ratio. If head circumference by chest circumference ratio is more than 1 after 1 year, then it signifies either macrocephaly or malnutrition. Now we go for one more circumference, that is Midarm circumference, one of the important circumference. All circumference are measured using cross tape method. The device used to measure this midarm circumference is Shakir's tape. This is how Shakir's tape looks. and it has three parts, that is red color, yellow color, and green color. Red color signifies mid-arm circumference less than 11.5, which signifies severe acute malnutrition. Yellow color suggests mid-arm circumference more than or equal to 11.5 centimeter till 12.5 centimeter, which suggests moderate acute malnutrition. That is green. Next is green. Green signifies more than or equal to 12.5 centimeter, which is normal. How do we measure mid-arm circumference? One of the important anthropometric parameters to measure in exam. So we measure from acromion process till onychronon process. We point the midpoint of that. While doing this, we flex the elbow. See here the elbows are flexed. We flex the elbow because to make olecranon process prominent. And we place one end of the tape at olecranon process and other end at acromion process. Then we take the midpoint of that. At this point, we measure the mid-arm circumference. How do we measure? We measure using cross tape method. So the measurement is 22. Because of cross tape, we should subtract 7 centimeter from that. 22 minus 7 is 15 centimeter, which is normal for child less than 5 years of age. From 6 months to 5 years, the cutoff is same for all ages. And it should be mid-arm circumference. Very important, very, very important. It should be done on non-dominant hand. Usually dominance appears by 2 years and establishes by 3 years. It should be done on non-dominant hand. Until then, until the dominance occurs, we can use left hand. And arm should be by the side of the patient. See, while pointing the mid-arm circumference, that is midpoint of the olecranon process and acromion process, the elbow should be flexed. After that, we should extend the elbow to place the arms by the side of the patient and we should measure the mid-arm circumference. This is one of the important procedure. After that, we go for bangle test. Bangle test is one of the simplest tests where we use 4 centimeter inner diameter bangle. If it crosses elbow, then it is suggestive of malnutrition. Then next we go for skin fold thickness. Skin fold thickness is measured using Arpenden calipers. This is how Arpenden calipers looks. So where and all we measure skin fold thickness. It is best measured in triceps and it can also be measured in biceps, suprascapular and subscapular areas. So suppose in triceps, the skin fold thickness is 10 millimeter or more, it is normal. If it is less than 6 millimeter, it is suggestive of severe malnutrition. Skin fold thickness of triceps less than 6 millimeter suggestive of severe malnutrition. Then the other things are compared with normative charts. Then we go for BMI. One of the easiest calculation, BMI, weight in kg by height in meter square. And we compare with normative growth charts. So what are growth charts? We discuss about growth charts in next video. Until then, like, share, and subscribe.